cancer was multifocal. What that means, it was across both lobes of the liver. And also because I had breast cancer, the only major treatments at that time was surgery or transplant. And because it was multifocal, I couldn't have surgery. I mean, you certainly can't remove the liver. You'd have to transplant. And because I had another primary cancer prior to this, I was not allowed to be put on the transplant list. The anti-rejection drugs that I would have to take, they said, would cause me to probably have a recurrence of my breast cancer. So I begged them to do other treatments that were available, which were limited, cryoablation, laser ablation, and I had too many tumors to even do those. So I asked for a second opinion and went to MD Anderson, and that physician, who was the lead physician in the United States, told me I had less than 6 months to live and to get my affairs in order, that there was no treatment available. That was very depressing. I lived in Dallas and he was in Houston, and so about halfway up, driving home, I cried and then stopped crying. And I said, I am going to beat this cancer and do everything I can to survive. And I changed my attitude and did it totally different than my prior cancer. And I decided to take charge of my health and become engaged with my healthcare team. And when I returned to Dallas and I met the liver transplant surgeon after the tumor board met, they decided that they didn't have any options either, and they were just going to watch and wait. So I just basically told them I was not going to let them watch and wait to see me die, that they were going to give me all the chemo that they had. That was on a Friday. On Monday, they admitted me to the hospital, and they did give me chemo. And it had never been done in the United States. I was admitted for a week, each week for 6 months. And I went into interventional radiology on the first day, and a catheter was inserted directly into my liver through the femoral artery and then the hepatic artery. And I laid flat on my bed for 6 days and was delivered 4 different types of chemo drugs around the clock for 6 days, and then went home and then did it again every month for 6 months. And I will have to say, after 6 months, the tumors were gone, and my doctor called me a miracle. And now that has been 16 years. I'm cancer-free. I will have to tell you that it was a harsh treatment. I lost 50 pounds. I was in and out of ICU many, many times, and I do have some long-term lasting complications from that. But I am grateful to be alive today. I would not have survived if I hadn't taken charge of my health, if I hadn't been part of the healthcare team and hadn't advocated for myself and pushed to have some sort of treatment. I hear that this treatment is used very rarely. Don't believe it's approved here in the United States, but it is used on occasion, and not very many people can survive this type of treatment. It's very, very harsh, and there's a lot better treatments available today. The treatments available today were not available when I was diagnosed. I'm so glad that pharma finally got involved, and there's many, many first-line and second-line treatments available today, so that people don't have to go what I went through. I guess I am so grateful to be alive. I now give back to the Maui County community, and I help other cancer patients go through their journey. And I've learned a lot, and I give back and help them go through their journey a lot easier.